I actually look younger than when I was 45. For me to actually start to look younger and younger, the key, besides eating healthy, is regular IV stem cells. I've done that every 3 months.
I'm going to introduce you to my favorite new doctor, Dr. Joy Kong.
This is Dr. Joy Kong.
Dr. Kong is one of the most recognized anti-aging doctors in the world.
Stem cells have already been shown to extend lifespan in animals. Even if they're old and you start to give them young stem cells, the amount of time they have left on Earth was tripled. Everything that I mentioned was changed to the younger state. The cells indeed are functioning at all levels as if it's a younger cell. I've treated a patient who didn't even tell me about his rotator cuff injury. Lo and behold, his rotator cuff injury that has been bothering him for about 4 decades went away.
What are your thoughts on, I've heard also that stem cells can grow things in the body like tumors.
I do have a specific YouTube video on this subject about stem cells and cancer. What kind of cells are you using? That's one of the most important things.
Hi, I'm Sarah Kugelman with Going Golden, and I'm very excited to have my guest, Dr. Joy Kong, with me today. We are going to have a fascinating conversation about stem cells and regenerative medicine. She is really briefly a UCLA-trained physician with triple board certifications in psychiatry, addiction medicine, and anti-aging and regenerative medicine. So she is a total rock star and keeps herself extremely busy. So we're going to get right into it. And welcome. So excited to have you here today.
Yeah, it's so nice to be here, Sarah.
And I think for the audience, why don't we start? There might be some people that don't really know about stem cells or stem cells in terms of medicine and skincare. So if you want to talk a little bit about what stem cells are and how they're impacting medicine today, that would be great.
Okay, so I take on a little bit more metaphysical take on stem cells, even though it is totally scientific based, right? This is one area in medicine that whether or not you are a holistic practitioner, a healer, or a traditionally trained Western conventional medicine doctor, everyone can embrace this field of stem cell therapy because it originated from science, right? Us finding out what kind of cells are actually in the body, just the concept of cells, that is very Western science based. And then we discovered these particular group of cells that actually have the capability to replenish us. So they are the source of new tissue and of repair, of regeneration. So we found out that in our body, everywhere we have stem cells, and then they have the ability to either create a coordinated effort to help with the environment of the body and make it more reparative, or they actually go into local areas and possibly become local tissues, or tell your own local tissue stem cells to make new tissue. So that's the Western approach. Of course, the holistic approach, we are borrowing the secret of life to repair life. And that is really what we're tapping into, which is the source energy. So the blueprint that's embedded in the DNA of the cells, that's what's making it really special. Why is the DNA so special? Because it has all the codes and it knows, it has the ability to interact with the environment and then create anything that's necessary. We can make a new protein, new enzyme, or even make another new self and use that kind of intelligence to interact with the body. And so what's embedded in the DNA is intelligence. Now we're coming to the metaphysical, right? What is intelligence? What does that really mean? What's intelligence that's housed in your own brain? And that deserves a whole long discussion. But basically, we have this intelligence that we can borrow from these cells to promote healing. That's why all the healers, all the naturopathic doctors and the chiropractors, everybody loves it, because now we're doing something that's not single-minded. Molecule A interact with molecule B to produce another effect. We're not doing something so simplistic. We're doing something that's vast, complex, and holistic. It's a symphony. It's happening all at once because the cells can produce 100 different molecules all at once, maybe 1,000 different signals. Everything's happening all at once, targeting all these tissues and all these aspects of healing. So that's why it's powerful. So you can see why this will make me passionate, because this is revolutionary. This is the first time in human history we are using intelligence to heal. Of course, there are other, ancient traditions of using yoga, meditation, and that's all tapping into that kind of potential. Of course, interacting with your cells, but no one had ever put cells in the body until now. Now we realize what is possible. So regenerative
Amazing.
medicine is definitely transformative. I think people had an inkling about it. But possibly that's why the Chinese had been eating placentas for some time. Even my mom had cooked one, I remember. But you're injecting probably a lot of good protein and good peptides, but you're not, those are dead cells. Africans have been using amniotic membrane for wound healing for hundreds of years. So they have a intuition that there's something that's really powerful in these tissues that are very regenerative.
Do you think that we're just at the beginning of starting to understand and unpack this area of science, and that we still have a lot to learn? Like, what are your thoughts on that?
Yeah, we have so much to learn. So we're barely crawling right now. So we're just getting a glimpse of what's possible. And just that little glimpse is so powerful. From that little glimpse that we can borrow from these cells, I have seen incredible improvements in my patients. It ranges from, it's funny, even though I'm board certified in 3 specialties, but I'm no cardiologist, I'm no orthopedic surgeon, I'm not a rheumatologist, I'm not a neurologist, I'm none of these specialties, yet I have seen incredible improvements in people who have sought out remedy or healing from all these specialists, and nobody could do much about it. But I gave them cells, and all of a sudden, everything started to change. So that's what's really, really powerful. Even though we are just at the beginning, we have just been able to isolate some cells from either the different tissue of your body, like bone marrow, fat. They can get it from menstrual blood and dental pulp and hair follicles. They can get it from a lot of places, or they can get it from birth tissue, which are, kind of a waste product after the baby is born, right? All the placenta and umbilical cord is usually thrown away. But now we realize it's a powerful source of stem cells.
This has definitely been a point of controversy, especially in this country. So typically, how do you harvest stem cells, and like what area of the body, or where do you get them from?
Yeah, definitely it should not be a controversy if when a woman gives birth, right, to a life healthy birth, what do we do with the umbilical cord and the placenta before? We threw them away. Now we're just taking that to extract incredible elements from it. So we're not hurting anybody. We're only bringing in healing. And of course, you can also get it from your own body, right? That has less controversy. You can get liposuction and get fat and then isolate cells from there. You can drill into your bone and get some bone marrow out and then get some stem cells from there. So the controversy may come from, one, embryonic stem cells that was researched. So that was earlier in the whole stem cell, excitement, that they discovered, embryos, the first fertilized egg, when it started to divide and form a new baby, at first it's just a ball of cells. Day 5 to 7, that's when you can go into that ball and pick one of those cells from the inside, and any of those cells can form a full human. So now they thought, oh my God, we cracked the code. We've got, we can use these cells for anything. Well, okay, first of all, there is ethical considerations, especially in this country, right? That's more of a point of contention. But even if there's no ethical constraints, the cells that were embryonic stem cells have not gone through the test of fire, because a significant portion of pregnancies don't really result in a live baby. right? A lot of miscarriages, a lot of things can go wrong during the development. DNA didn't go perfectly, that maybe the composition wasn't good and the environment wasn't quite right. To actually form a full human being, I think that's one of the best way to test to see if these cells and all the DNA it contains are actually good. However, when you get it from an embryo, you haven't been able to see whether or not a fully functional human being can be made from these cells. A lot of things can go wrong and they can develop into fresh new tumor. And that has happened. So we're having trouble controlling that. And that's banned in the US from clinical use. So you can't just say, oh, I do embryonic stem cells, I can give you stem. No, you can't do that. You can do research, so you can still do research. George W. Bush banned federal funding for anybody who wanted to destroy more embryos. He didn't ban everything from people conducting the research, but he just would not allow people to destroy more embryos. But that's part of the controversy. The other part, that people think that babies were hurt. First of all, in the US, no one is doing fetal stem cells. I mean, I don't know if there's research going on, but definitely no one is using it clinically. I haven't heard of any single facility, lab, anybody that's even, getting anywhere near and close to that. But in some overseas countries, there are countries that are using it. So the controversy, well, yeah, that's something to consider, right? That's a destruction of a fetus. So that's a whole other, but we're not dealing with that in the US.
Right. And just in terms of this whole concept of sort of anti-aging or pro-aging, I like to say pro-aging, more positive, or longevity or living a life that with better wellness, how can stem cells, in your opinion, affect how we live longer and better?
Stem cells have already been shown to extend lifespan in animals. So that's, first of all, consistently. Regular stem cell infusions, so of younger cells to an older animal's body, whether or not the animal is middle-aged or a senior animal, usually rats or mice, because they only live for about 20 months. So the study, is not going to go on indefinitely, So we find out how long we're able to extend the lifespan, generally about 30%. So that's been consistent. And in older animals, like a human equivalent age of 75. So that's a pretty old animal. Even if they're old and you start to give them young stem cells, the amount of time they have left on Earth was tripled. So that's in one study. Yeah. So it's never too late. So it can, and not only extended their lifespan, because a lot of people don't care, like me, I don't care how long I live, but I want to live well. I don't want to suffer from aches and pains. I want to be really vital in my mental capabilities and my physical abilities. So that's what they found out in these animals, that they have, more shiny fur, even shiny fur. They've better hair, and then their locomotion, right? Their ability to move their bodies is better, like a young rat. And then their ability to navigate mazes, right? They could remember, they know where to go.
Yep.
That's preserved.
Yep.
And then when they dissected the animals, this is the cool part. They actually dissected the brain and the muscles of these animals and checked to see what their neurotransmitter levels are. What about the toxic waste that's usually built up as the cells age? What about the senescent markers? Are markers and that start to show up when the cell gets older. And so they check, and growth factors, do they secrete enough growth factors to promote, right, ongoing vitality? Everything that I mentioned was changed to the younger state. So instead of what it should be, which is which is the level of an older animal, all of them got back to the younger state. So physical evidence showing that the cells indeed are functioning at all levels as if it's a younger cell.
That's really amazing. I went to hear a longevity expert and a gynecologist speak last week, and she was saying something that I've always believed to be true, which is that aging is a disease. And if we can unlock through stem cells, growth factors, some of the things you're talking about, we actually can reverse something that really is like a disease, not something that's natural and should be happening.
Yeah, what a mind-shifting concept, right? Imagine all of history, the humans have been sick. It was like, what if
Exactly.
we get them well? We get the whole species well. I mean, what a concept, right?
Yeah, it's an incredibly mind-blowing concept. I agree. So how do you administer the stem cells? Like, are they transfusions? Are they injections? Do you use them topically? What is the best way to?
Yeah, so it really depends on what we're looking for. So that's the art of stem cells. I always say there are only two things that matter in stem cell therapy. One is the cells. What kind of cells are you using? What have these cells gone through? And then the second is where to put it. You need to put it in the right place. A lot of times you can produce incredible results by just IV route. So intravenously, the cells will also depend on what kind of cells you're giving. But for example, we use a lot of mesenchymal stem cells. And these cells already in the human body, their regular residence is right outside your blood vessels. They're literally holding on to your blood vessels, like a gecko. And they're sensing what's going on in your blood and sensing what's going on in the neighborhood around it. The way it works is that either it senses something and needs to coordinate some kind of repair. Let's say it senses something in the systemic blood flow. And then there's something going on locally that needs repair. So they could send signals into the blood and then send signals into the neighborhood to promote this regeneration, right? Into the blood, probably bring in the immune system. Or they can just get into the bloodstream. They do that a lot. They squeeze themselves into the blood vessels. It's a very dynamic system, right? Think of what's going on in the human body. They squeeze themselves into the blood vessels and they start to swim upstream to find out where things, where the signal came from. What can I do? Like, let me find it. And once they find it, then they can hold on to the vessel and get out of the blood vessel and start working locally. These are, the IV route. That's why it's so powerful, is because one, you're kind of replenishing the supply of these cells that are capable of generating signals. And of course, they're attracted to areas of inflammation and injury. So they can just swim right in, when they're in your blood, and then they can just find out where the problem is at and they aggregate there, which is what I've found. I've treated a patient who didn't even tell me about my very first patient, his rotator cuff injury. We were all focusing on his knees. That's all we were thinking about because he thought he'd had to have bilateral knee replacement. So I was focusing on the knees, give him an IV infusion, injected into both his knees. Lo and behold, his rotator cuff injury that has been bothering him for about 4 decades went away. So that was opening my eyes to what the cells, like, I think I know what's going on. Well, the cells, they have a mind of their own. So sometimes maybe a patient comes to us looking at fixing one thing. Okay, I have this diagnosis. This is the one thing I want to fix. Well, if they have a lot of inflammation, they have other things going on, the cells don't always do what exactly you want to do. They go to where they think is the loudest and where they want to help. So sometimes you need waves of stem cells in order to hit all targets, right? Because you're giving one set of troops and there may not be enough to fight all the battles. And then you have to send another set. So IV, I think, is a cornerstone because it literally talks to your immune system, communicating with your immune system. The age of immune system is highly tied to how well you're going to be, right? How sick you're going to be, how fast you can repair. So if you can get the immune system to be more amplified and boosted, now you can repair so much better. However, there are areas that's a little difficult to get to just by an IV infusion. For example, somebody have knee problems, shoulders and hips. Those larger joints have very low penetration when it comes to the blood. And whatever I give in the blood may take months to get into the joint space. So if you have a joint degeneration, it's better to put something right in the space. So then we do a lot of intra-articular injections, injecting into the joint space. Or there are things that you want to fix. For example, hair restoration. We do that a lot, helping the hair to grow back. Then you may want to put the cells right there because you don't want it to be diverted everywhere. Facial rejuvenation, sexual wellness. We inject right into the penis or vagina, helping with the local tissue repair,
Wow.
vascularization and improving sexual function. So it depends on what we're trying to do. And if we're trying to target the brain has this thing called blood-brain barrier that's making it difficult to reach. So we use different ways in our clinic. One is using mannitol to open up the blood-brain barrier for only just about 40 minutes after the mannitol infusion. And now we've got the brain that's more open, more cells can get in when the cells were put in IV route. Or we can use intranasal protocol. We can inject into the nasal membrane, or we can use, exosomes, and which doesn't require injection.
And is that so the brain tells the body where to go, or?
Oh, no, there are brain conditions, like a lot of people
Oh,
have
I see. Okay. Oh,
neurodegenerative conditions. Yeah, so we want
got it.
to
Oh,
get
so
more
interesting.
cells. Yeah.
Got it. So, of course, as a beauty junkie, I want to ask a little bit more about skin and the way we look. So, if somebody comes to you and says, like, I want my face to look younger. I have too many wrinkles. My skin's starting to sag. What would you recommend? How to address that with stem cells?
I would have to say that my biggest secret is IV infusion. So that's the only thing I've been consistent with since I got into the anti-aging space. So that was about 10 years ago. So I started doing IV stem cells when I was 45. So tomorrow I'm 54. So
Wow.
yeah.
You definitely look amazing.
Thank you so much. So the key for me to actually start to look younger and younger, I actually look younger than when I was 45. The key, I think, besides eating healthy and eating healthy is probably the most important thing. Besides eating healthy, is regular IV stem cells. I've done that every 3 months. And I knowing from what I know of the animals, of course, there's some human studies as well, with people seeing improvement in the quality of their skin and hair within 3 to 6 months. So that's, I believe that every 3 months when I do an infusion, I reverse the age of all my cells backward. And then I may,
That's incredible.
yeah, and then I may age forward, right? Because I'm living. So I age forward. And then I get another infusion, then I bring it back. So I'm like doing this yo-yo where I'm fairly stationary or even backward, I think I'll tell you something that's interesting. It's really fun. I don't know if you have children, but women.
I do.
You do. Okay. Congratulations. Women who have been pregnant compared to their counterparts that have not been pregnant. They looked at what happened to their biological age. So the one that had a pregnancy, their biological age was actually brought back 4 months. So they're biologically 4 months younger. So that's very, very interesting.
There's a lot of women that are going to be very excited to hear that.
No, I guess that's why some women, they can give birth to so many and they're not somehow dry.
Yeah.
Tapped out of all their
4
life
months, 4 months.
energy because they keep getting life energy from the pregnancies, probably.
I actually just read something, I forget where I read it, but it said women who have babies after 40, which I did, increase lifespan by, I forget what it was, but significantly increased lifespan.
Wow, that's wonderful. Yeah, it's beautiful because so I thought that I was just getting a mini pregnancy every 3 months. So that's kind of yeah. There's a lot of exchange between the mother and the baby that she's carrying. We know that there are stem cells from the baby everywhere in the mother. So there are one easiest way to find out is to check Y chromosomes in females, right? Females XX. Mm-hmm. So if you got cells that has XY, where'd you get it? Well, it's from your past pregnancies. And guess what? When they looked at, I think it's 60% of women actually have Y chromosomes in their body. So they have cells with Y chromosomes, and they could not account for that with just with pregnancies of male children or having had a male sibling that you may have coexisted with and then died later on that no one knew about, or any kind of miscarriages. they were adding all the statistical, analysis to account for 60% of women having Y chromosomes. And then
That's fascinating.
And then their final conclusion is that there's the only way to explain it is through sexual intercourse, that men and women exchange DNA. So the reason I mentioned this is so that I want to dispel this fear that, oh my God, I don't want other people's DNA in my body. You already have them. So just as part of human existence.
You can't avoid it.
Yeah, it's there. Just like you have a ton of bacteria, you have more, the more bacterial DNA in your body than human DNA. So we are a conglomerate. We are a little universe that's carrying a large, variety of organisms in us.
Yes. Yeah. We're very complicated, to say the least. What are your thoughts on, I mean, I've heard also sort of on the other side of the coin that stem cells can grow things in the body like tumors. So what do you say to people who are scared about them?
Yeah. So I do have a specific YouTube video on this subject about stem cells and cancer. So again, like I mentioned, what kind of cells are you using? That's one of the most important things. So first of all, I mentioned when you use embryonic stem cells, these cells can actually go haywire and start to create a new cancer, so new tumor. So they basically, they start fresh and make a tumor for you. And this has been shown in patients who are going overseas, have gotten embryonic stem cell treatment, and then grow a tumor in their spine. Somehow the spine is a popular place. But then we don't use that in this country, right? There's very few people use embryonic stem cells, but you have to be careful with them because of this. And you have to also be careful with the induced pluripotent stem cells. So the induced pluripotent stem cells, everyone thinks, oh, that's a holy grail, including me. Let's say we take your skin cell and make it a embryonic stem cell that can make anything in your body. And you're like, oh my God, we just found the final answer, right? We just revert it and then we get the cell and we can make anything from it. Well, only if it's that simple. The way that cell is produced by, there are some kind of viral vectors to allow it to, insert certain signals in the cells, in the DNA, and that can trigger changes in the DNA. And that in turn turns on mechanisms, again, makes it wild and difficult to control. So it has the same problem. So those two are not really used clinically in the US. But if you're looking at using your own cells, people think that's the safest. I have news for you. It is not. The older you are, the more risk that you're going to carry by using your own. We all think we're so perfect, but indeed we're not. So some people have illnesses.
Could it be like latent illnesses too that you don't even know about?
Yeah. And some people have, including autoimmune diseases. Some people believe that is a stem cell defect kind of disorder. So they're different. I'm sure they're different mechanisms. But the using your own when you are older, the older you are, you get 30, 40, 50. Now we're getting more and more genetic changes because the cells have gone through oxidative damages and toxic, accumulation.
Yes.
All these things can change the characteristic of the cells. Not only they're more sluggish and less potent, but they can also lose intelligence. What I mean is that when the cells are younger, they're capable of recognizing when another cell is not a good cell. It's a cancerous or precancerous cell. Something's wrong with that cell. They're able to recognize and then send relevant signals, probably send like warhead, a weapon, put that into that cell that's behaving strangely, that doesn't belong in the human body, and kill that off. But the older the cells are, the less it has that ability. So we all know the biggest predictive factor for cancer is age. The older you are, the more prone you are to getting cancer. It's not like we don't have cancer cells showing up in our body all the time, but the older you are, the less capable your immune system
Right. You got to
is
fight it off, right?
at kicking it off. And so you already are weakened. And now you're putting these cells that have the tendency to make things grow, right? They're promoting growth. They send growth factors. So if there's a combination of sending potent growth factors with a less ability of your body to protect itself, and these cells, instead of actively attacking cancer, the mesenchymal stem cells from a younger tissue will attack the cancer and kill them off. But that ability gets less and less as a person is getting older and is getting
Yeah.
less well. So, because there are direct comparisons, if you put umbilical cord derived MSCs, which is mesenchymal stem cells, next to a cancer, a tumor, glioblastoma, versus a fat derived, from an adult person, fat derived MSCs, put it next to the same kind of tumor, right? They side by side
Yeah.
comparison, either in a petri dish or on a live animal's body. Both circumstances, the fat derived stem cells will make the cancer grow, but the umbilical cord derived stem cells will make the cancer shrink and go away. So that's how powerfully different it is. So you can't just make a blanket statement of the stem cells, and exacerbate cancer. What kind of stem cells? If you start to grow the cells, like what they do overseas a lot, they can expand it to many generations. So every time you double, right? Every time you grow, the cells double itself, and then you allow them to keep doubling. All of a sudden, you get massive number of cells. However, most of those cells are no longer the original stem cells because that's the nature of the cell division. They rarely divide symmetrically, only under particular circumstances. So most of the time that they divide asymmetrically and you're producing all these cells are further down the line, and they also accumulate senescence. So every time you divide, there's a chance for the cell to get old, make mistakes. The DNA messages get warped. So now you've got deteriorated and aged cells through the expansion process. Even if you get the cells from the umbilical cord, you just keep letting them grow and grow and grow, then they just get weaker and weaker and older and less competent at recognizing cancer.
I have a question for a layperson like myself. What is the difference between a growth factor and a stem cell?
Stem cells make a lot of signals, including growth factors. So growth factors is just a molecule, it's a particular structure that the cells make. It's just one thing, usually a protein. Yeah. So cells are the mothers of growth factors.
Got it. Okay. All right. So that's interesting. So what about, I think a lot of people feel like with everything in the environment and everything that we use day to day, cleaning products, shower gel, pollution, now microplastics, heavy metals. How do we get rid of all that toxicity? Are we just doomed, or is there a way for us through stem cells or through other ways to really rid the body of these things that are going to eventually take us down?
I don't know stem cells is going to take out the toxicity. I think you have to go through detox process. The stem cells may make your system more effective, everything functioning better, including the liver. So it may help you detox, but you really need a really effective way of detoxing. And that's a whole other field in anti-aging medicine or holistic medicine. You can do a lot of sweating. You can take different supplements to extract the toxins. There are even light therapy, energy therapy that can help your body get rid of the toxins. But I think you really need a concerted effort. Yeah, that's a whole other thing. Actually, I think sometimes, rarely, I would say at my clinic, over 90% of people will see a good response from the therapy, but there may be 10% that don't. And I think a lot of it is because they have underlying toxicity that's preventing the cells from working well or underlying infections. So the infections can just put a stop to a lot of healing.
All right, we'll have to do an episode on detoxing. What are you most excited about in regards to stem cells?
I think getting it to more people, so more people can be elevated in their health and healing and live a much more vibrant life. So there are a lot of people who are seeking it and they're benefiting from it, but a lot of people still think it's very expensive and it may not be reachable. So I'm trying to work on ways to get that to more people. And also dispelling the myths.
Amazing.
But I want to get them to more people. I don't know if you probably know the statistics that if you can reverse aging or decrease the biological age of everybody on the planet, or let's just say everybody, in the US, by 7 years, then half of the chronic illnesses will be gone in that population. So you're
Wow.
drastically changing the landscape of human health. So
Wow.
yeah, if we can do that for everybody. And I do believe that the stem cells is doing that because we have seen evidence of reversing, changing the
Mm.
telomere length and then reversing biological age. The evidence is showing up.
Wow. So it sounds like there's,
Hmm.
like a huge advocacy side to all of this too.
Yeah, and it really should be something as common as antibiotics. It shouldn't be a big deal. People should be able to take it prophylactically to prevent the aging decline. But like you mentioned about stem cell, where we're at, I think we're just at the tip of the iceberg. And, we can do a lot of things to the cells and to talk to the cells and reverse the age and even frequency. I think energy therapy will be the
Mm.
next stage in medicine. Yeah,
Ooh.
that goes again metaphysical, right? Energy. What is energy? What's frequency? Why are there healers who are able to heal with their hands or with their thoughts? What's going on there? So that's you can program the cells, I believe, with frequencies.
Yeah, no, I've studied energy a lot just in the beauty industry. I mean, from a physics standpoint, everything is energy in our environment. And so when you really start to think about that, I've read a lot about it too. I mean, it makes perfect sense that you can control energy. Energy affects everything about us, the way we think, the outcomes of certain situations, our health. So I think that, we're really on the tip of the iceberg of that whole
Hmm.
field as well.
Yeah, yeah.
Is this something people can ask their providers about? Or is it really just sort of people on the edge right now who are really sort of on the
Yeah.
forefront that are doing this kind of therapy?
If you're trapped in the traditional medical model with the insurance and big pharma, taking care of you, then you're not going to hear about it. There may
Hmm.
be a fraction of the doctors in the conventional field that actually have heard much about it or is even thinking that's a possibility. I speak this from experience. I don't really meet that many doctors from the conventional side, although sometimes we have patients who are getting care from them and they know almost nothing about it. And once in a while, maybe, I don't know, maybe 1 in 20 will actually be open to it. Most of them, their typical dismissal is, oh, it sounds great, but there's really not enough evidence yet. And it's laughable because uh, the only reason they say there's no evidence is because they haven't looked at whether or not there's evidence. And if they have just even bothered to put in some Google search, then they will realize research has been very active from all around the world. The evidence is so inspiring. And that's why I started the Academy, American Academy of Integrative Cell Therapy, is to show people, teach doctors that look at the evidence we already have. How about think about your patients that you're struggling with? Look at what we can do
Yeah.
now. So
Yeah.
yeah, unfortunately, if you are trying to seek stem cell therapy by talking to your conventional doctor, good luck. But if you're
Yeah. Yeah.
somebody that's
That's too much.
open and you're looking for solutions and you're able to do your own research, you may actually find people who are very active in doing therapies like this. I've trained hundreds of doctors and I know the kind of incredible work that they are able to do, the recoveries that they can see in patients. So seek out people who actually know, who actually have done it and have seen it, and don't trust your doctors that's trapped in a particular system.
Yeah. So people really need to do their homework. I mean, since I was 25, I've been doing, seeing an alternative medicine, sort of more Eastern medicine related doctor, nutritionist, kinesiologist. And, I used to sort of think of it as magic. Like, I don't know how that happens, but it just makes me better. But, I think a lot of those things in the last 30 years have really come into the mainstream. I mean, adrenal fatigue and issues, especially for women with their thyroid. And, there's so many things that you can do that don't have side effects and that are really positive to correct these things versus just taking, Western medicine that are so incredibly powerful and helpful for health and wellness. I think too, having children, I have a daughter who had a lot of health issues growing up, and I really turned to alternative medicine because sadly, Western medicine didn't know how to help her. She, for instance, had anaphylactic allergies, and everybody said, oh, they can't be cured. There's no cure. And I said to my daughter, we're going to find a cure. There's a cure somewhere. Somebody's working on a cure somewhere. And we found a clinical trial and she was cured. So I do truly believe that a lot of things that are on the cutting edge of medicine, we need to support, investigate, do our research, and really help to drive them forward, because a lot of times it's not in the best interest of big pharma to let these things rise to the top.
Right.
So,
until they get sick themselves. So, and sometimes, getting sick even though it may be unfortunate on the surface, but make you dig deeper. And then you actually, a lot of people change their lifestyle, make better choices. Whereas if you think you're fairly healthy, you're strong as an ox, and you don't need to pay attention to what you eat and what you're doing to your body, then they may end up doing a lot of damage. So the being healthy and fortunate sometimes doesn't mean that it makes you more open-minded. It may make you more arrogant as to what you can do for your body.
Well, I want to ask you, you've been so generous with your time, and this has just been fascinating. How can people learn more about what you're doing or find you? Can you tell people, do you have a website, social media? Tell us.
Yeah, my YouTube channel probably is the best form of education for anybody that's interested in stem cell therapy, because I think I put out more material than anybody I know when it comes to all these different aspects of stem cell therapy, including where do you get it, how much cells should you use, how frequently should you use, what should you expect, and, the relationship with cancer, how do you approach osteoarthritis, what about autism? So all these things, there are different subjects that I cover. So that's a great place to be more educated. I have a lot of people going down the rabbit hole on my YouTube channel. And then the other place is my website if people want to know more about what I do. So it's just joykongmd.com. That talks about my clinic, Chara Health in Los Angeles, the academy I've founded, American Academy of Integrated Cell Therapy. We do twice a year in-person certification training, very in-depth education on providers. And then I have a stem cell distribution company that we provide, I believe, to be the best stem cell product and exosome product in the country. I support a lot of doctors and helping to make sure that they are giving people the best product possible and are practicing in a way that's most effective. And then I developed a cream called Chara Omni. So that's a stem cell cream that's very popular, that it's 100% natural. You mentioned things about toxicity in the environment. That's a big no-no for me. I absolutely refuse putting things on my skin that I know are toxic. It's so funny. I actually went to Florida for business, and I forgot my own cream. And I was freaking out because I knew every time I forget, I can't. There may be other creams. I mean, I have all kinds of creams. I have a lot of creams, like beautiful samples. All these products that was given to me, I'm just not comfortable putting them on because there are all these synthetic ingredients. And we all know there are a lot of unforeseen issues with these molecules that our body don't recognize. And I want something 100% natural. So I ended up just not putting any cream on my face, when I forgot my cream, because I would rather my skin is a little bit drier.
I understand.
Yeah, I was like, oh, it's okay. It's okay. At least I'm not poisoning my skin. So
Exactly. Much better.
Yeah. So, and I have a podcast if people are interested, the Dr. Joy Kong podcast. So I interview a lot of people in the health and wellness space. So just helping to spread good information so people can, amplify what they do for their health.
Amazing. Well, it sounds like, and clearly you're doing a lot of amazing things to help people all over the country and probably the world. And so I know how busy you are. Thank you so much for your time today. And I appreciate you being on Going Golden.
Absolutely. Thank you so much, Sarah. I enjoyed the conversation.